Hi, this is Chee-Wee here. Now, this week, we will be focusing on our critical appraisal and evaluation skills for studies looking at diagnostic tools. Now, this will help us to actively apply some of our knowledge about diagnostic accuracy and study design integrity. To help us along, I've put up the video by the Critical Appraisal Skills Program, or CASP, on how to evaluate diagnostic studies. I've also provided a link to download the CASP checklist for diagnostic studies in this week's task. It will be useful to have the checklist in front of you when watching the video. If you would like to assess your own knowledge of the content relating to the CASP video, I've also provided the self-assessment quiz put up by CASP for you as a link below the video. After you've watched the video, we'll put our critical appraisal skills to practice. We'll be looking at a paper by Trilos and colleagues published in 2018 on the diagnostic accuracy of the upper limb tension test 1 for diagnosing people with carpal tunnel syndrome. Have a read of the paper, then try to answer the questions within the CASP checklist using it to evaluate the study. For a bit of context, I've also included a video by physio tutors on upper limb tension tests so that you know what they are. Since the paper we're evaluating talks about upper limb tension test 1, so that's your main focus here. The activity for this week will be to participate in a discussion board for critically appraising the paper. Now, within the discussion board, there will be 2 discussion threads. The first discussion thread will be focusing on criticizing the design of the study we are reading. This will be based on questions 1 to 6 of the CASP diagnostic checklist. The second discussion thread will be focused on reporting the results and interpreting them. This will be based on questions 7 to 8 of the checklist. We won't be discussing questions 9 to 12 of the checklist. The reason for this is that these questions are clinically context-specific. We'll need to determine a specific local patient population that we are interested in for applying the results to, for this to be relevant to us. However, this doesn't mean that it isn't important. In fact, these are questions that you might want to consider for applying to your coursework when there is a case study involved. Of course, in the longer term, these questions will also be applicable to you when there is to your work settings, when you're required to sieve through literature to inform your own clinical practice and that of your services. Have a go at doing these tasks, and I look forward to interacting with all of you on the discussion board. So, I'll see you then.